Welcome. Thank you so much for joining me, and thank you if you're coming here for the first time. I'm Marlene, the parent, and I'm excited to have you here. I'm talking about eczema and the myths and misconceptions about eczema. Now, I have a presentation that I'll be sharing with you, but before that, let me just share what I normally find most of the times people to associate with eczema, especially the folks at home in the village. Now, most of the times when I explain that our children suffer from eczema, and they're like, okay, how does it work? These ones, the ones that I can see here on their cheeks, them they associate eczema with a spell, like someone cast a spell on my children. Someone can believe that, and another person might not believe that. Because a spell, if someone was to cast a spell on you, like traditionally or a long time ago, what used to happen is you'd have like your skin would start drying up, or you have things that look like scales on your skin, probably your face or any other part of the body. So since probably they've never heard of eczema before, they still associate eczema, a spell, like someone did cast a spell on your child. Now, the reason why I'm saying it's a misconception is, okay, I have my firstborn who has eczema, the skin condition, and then right now with my set of twins, my twinnies, they equally suffer from eczema. Now, I wonder, this person who casts a spell on my children, this person did with the first, and then these are the two. No, it can't be. It can't be. And then, like, I've worked with doctors, pediatrician, and then dermatologist, and truly it's a medical condition. Plus, in our family, we have people who actually react to different food items. I know of someone who can't take Blue Band, can't take peanuts without actually having rashes and severe acne on the face. So you see, with that, we tend to have eczema in our family. The only difference is for some it's severe, for some it's mild. But associating eczema with a spell, no, that is a myth, that is a misconception. And so with that, when someone tells you that they know of a herb or some doctor, like a herbalist who will actually clear your eczema, eczema is a skin condition, and people who suffer from eczema are normally so sensitive, and trying to cure this with something that is not proven medically is quite a risk. So don't. Let us go through the other misconceptions and the other myths about eczema. Follow me. Now let us look at the other myths and misconceptions about eczema. Yes, it is a misconception to say eczema is contagious. Eczema is not contagious. We are talking about eczema and not leprosy, my good people. Plus, we are in the 21st century. Leprosy is so scarce, if at all it does exist. That one is contagious, but eczema is not contagious. And then a person who suffers from the condition eczema, which is a skin condition, cannot infect another person directly or indirectly. It is equally wrong to say eczema is curable. Now, it is not. Eczema is not treated. Rather, it is just managed. Most of the ointments, cream, and oral medicine that are given to eczema patients, it's just to relieve them from severe symptoms like itching and excessive dry skin. Now, the best those ointments do is to clear the rashes. Now, with proper management of eczema, the patients normally live a healthy, normal life just like any other person. It is equally a misconception and a myth to say that eczema is a children's disease, like a disease that just affects the children. No, eczema is not a children's disease. Truly, it is more common on children, but it does not exclusively affect the children. Now, we have several adults who have the condition, and the only difference is that most adults have learned to keep the flare-ups in control by tracking the triggers, and then they've already figured out what works for them and what does not work for them, making it not so visible as it is with the children. Now, saying that eczema is not a serious condition is not okay. Now, as much as eczema is not life-threatening, let's say like Ebola, now we have to remember that it is a chronic disease. It is a chronic condition. It is a condition that lasts a very long time, and that long period of time equals to a long period of dry, itchy skin, which can even affect the self-esteem of the patients, as it affects how the patient looks like. And it doesn't choose. Some people have eczema on the face, on the head, some on their arms, and then the fingers, others the legs, knees, you know. So in a way, it can actually affect a person's self-esteem, especially when you value the way you look and how you present yourself. Now, those who believe that eczema is caused by poor hygiene, no. Eczema is a skin condition that is triggered by a wide array of triggers that vary from one patient to the other. And poor hygiene is not one of the triggers. We could be talking about dust because of the dust mites as a trigger, but generally poor hygiene is not. So don't see a person who suffers from eczema and start stigmatizing them, thinking that they are dirty. No, it's because of the dirt that now they have those two rashes. It's because of the dirt that they have a dry skin. No, it's a skin condition. It's a medical it's a disease just like any other, and it is not caused by poor hygiene. So if you have a child or a person who has eczema, stop trying to tell them like, okay, you need to bathe well, bathe thoroughly, ensure that you scrub your skin. No, it is a disease. Assuming that eczema is caused by same triggers. No, it's not caused by same triggers. Now we have so many triggers that affect patients who have eczema, and these patients have different and varying triggers. Now let me take you through a few of the triggers that I've listed here, and this is not exhaustive. No, it's just examples. Now, like animal protein and dairy products like beef, chicken, fish, eggs, and milk. We have people who actually, when they take some of the listed animal proteins and dairy products, it affects them, like it triggers an allergic reaction, and then they have those rashes on their skin. Some react to wool and lace products like a lace dress, clothing, or a woolen bedding, woolen toys, etc. Some medication equally trigger allergic reactions. Like we have people who are allergic to antibiotics, you see. So that can actually trigger an allergic reaction. And then we have those people who are allergic to pollen. Pollen from plants, like a flowering maize crop, can equally trigger eczema, or pollen from flowers. And then dust, as well as animal fur from cats, dogs, and other pets, that can also equally trigger allergic reaction. And then we have some soaps, lotions, detergents, sprays, insecticides, and air fresheners can also trigger the eczema reaction. So it's not all, but some, especially some of the scented soaps, lotions, detergents, and all these items can trigger a reaction. Now, lastly here, I have listed herbal medicine for eczema. Now, this is serious because it's something that actually happens. Now, alternative medicine like the traditional herbs for curing some conditions are okay. However, with the sensitivity of eczema patients whose skin can react so rigorously, such trials with the herbs should not be considered, especially if these herbs have not been proven medically. And eczema has no cure yet. It can only be managed. So, herbs haven't been recorded to have treated eczema, and eczema so far does not have a cure. It's not treatable. It can only be managed. So, you don't want to start giving your child herbs because someone mentioned that he or she heard of someone who actually got cured of a skin condition that resembles your child or someone that you know, and you also want to give it a shot. No, this condition is very serious because of the sensitivity, and you just don't want to do anything that could affect your child or a relative or a friend that you're trying to refer to. So be warned and just take precautions. So these are some of the eczema myths and misconceptions that actually exist, and you'll get to hear them from family members, from friends, and even just colleagues, neighbors, but knowing them and having that knowledge that they're just misconceptions will guide you so that you are not misled and you don't try things that are not working or workable in your situation. Now, those are some of the myths and misconceptions about eczema. So, whenever a person is mentioning these misconceptions or myths, now you are knowledgeable enough not to fall into that trap of misconception and myths. Thank you so much for watching, and remember to share widely so that it can help someone, a parent who has a child or children suffering from eczema, or just an adult but hasn't gone to the hospital, because sometimes we really take things for granted and probably they don't know that they're suffering from eczema. So remember to share and subscribe. Thank you so much for watching.